How to complain politely.
Okay, so as you go in to an emergency
In a hospital. Yeah.
You get in, you meet first of all who? The receptionist.
The rude woman behind the desk. It's always a rude woman behind it. Sorry to be. It could be a rude man as well.
I haven't seen many men on
it's a rude
receptionists.
woman.
I don't know why they always put women.
I don't know.
And I don't know why they're always rude. The majority, at least.
Yeah.
Anyway, the first thing you get asked, if you even get looked at, is your name, date of birth, your emergency. All right, go and sit down. Do you get asked if you have a special needs? If you are a special need? Do you get asked if you need any assistance? Do you get asked of how emergency is the emergency?
Any allergies? Yeah,
So you sit down.
Yeah. If you ask how urgent is the emergency, everyone's going to... For you, your emergency is the worst, isn't it? I had to go to A&E with my mum recently. Mm-hmm. She had a nosebleed that wouldn't stop. I did say to her, if you'd left all the blood, they might have got you through quicker.
Oh, the fact that they saw the blood.
Yeah.
But is this, look, as you said, the receptionist would see how emergency is.
How urgent is the emergency.
Yeah. Right?
Okay.
Like someone could have heart attack.
Mm-hmm.
And it is more urgent than someone who's having a nosebleed.
Earache.
Sadly,
Yeah, that's true.
Okay, then you go and wait in the room. Now, leave the receptionist. It's all right. You can meet nice people. You can meet rude people. This is life.
Okay.
It's all right. You've met the receptionist. You sat down. You get to meet the nurse afterwards who have to assess your temperature. Mm-hmm. You'd be very lucky if you have temperature.
Because that will make it more urgent.
No, because you'll be taken away to a room.
Oh, so because you don't infect other people?
Yes.
Okay.
So you'd be very lucky.
That did happen to me once, actually.
Yes,
You're right.
exactly.
Do they still do that?
I think so. Like, I think still temperature is a problem,
Yeah.
Like, I think COVID still mentioned. But anyway, you get taken to a room if you have something that will spread to other people.
Okay.
Most of the time. If not, then you sit down next to a lot of infected people. I mean, you don't know what these people have next to you, right?
Yeah. And
there's hardly any food in the waiting room.
Mm-hmm.
Really, really, like the options that you have is hardly anything. You have to walk out from the emergency in most of the places.
Keep going.
To the main hospital to buy some snacks or food or whatever. And you'd be lucky if you have a store open at that time. I mean, it depends on what time you went. Or the option would be the vending machines. Sometimes, if you remember, we had people offering us food. Do you remember?
But in the hospital?
In the emergency while we were waiting. Do you remember a guy came who looked... the guy looked quite rough. And he opened... No, but this is... So you should not judge people,
okay.
He opened his...
A patient looked rough? Or
Yeah. So I was waiting there as well.
Okay.
He was wondering why our son was going all over the place and he opened his bag.
Mm-hmm.
You thought that it would be a knife coming out. And he offered the crisps and food.
Did he have tattoos?
Yeah, he had tattoos.
I remember that.
And he came and offered food to us, saying, if your son is hungry.
Mm-hmm.
The waiting hours, they say to you could wait up to 4 hours. Is it 4 hours? It's never 4 hours. It's 24 hours. It's like you've misheard the 20.
With my mum, it was very late, and we'd waited for a couple of hours, and then they called her name, she went up, and I think she thought, that's it, I'm going to be seen, and they took her blood pressure or something, and then said, go sit back down, and we were not sure, hang on a minute, is this a mistake? Why are you dismissing me? My brother said, they do that just so you feel like it's moving along. And psychologically, you probably do feel like, I got up, I had my blood pressure. At least they're doing something.
Yes.
At least they're checking on me, and I'm not in a real critical condition. But it's not easy. You would think they'd be better at prioritising who goes when.
One of the main problems that they have is lack of doctors. They don't have enough staff. They don't have enough nurses. They don't have enough doctors.
Sometimes you will be seen by someone who is not a doctor but is a health professional.
Yes.
And you'll kind of, if you don't ask, they won't say anything, or you'll kind of assume it was a doctor. But you might not even be seen by a doctor. Look, it's great that we have an NHS. I think it's great that we fund healthcare that way.
We are here.
There are things
we are discussing things to improve.
Yeah.
No, we're not criticizing the fact that we have NHS. Of course, we appreciate when we are in a better position than other countries. Of course, but we are here discussing how could we improve this service better. What can we do to help? We were all clapping for the NHS at some point, right? Those doctors, those professionals work really hard. And really, there's so much pressure on those two doctors on the world. If you think about it, those two doctors have to see all these urgent emergencies, and they're probably hardly able to take a break because there's only two of them on ward that night, right?
Is there only two?
I mean, that might be one of the issues why all these patients cannot be seen is because they don't have enough doctors. If they have enough doctors, it might not be the case, right? And then you have nurses that would come and offer you the service, as you say, like healthcare workers or nurses that would offer you the service that the doctors, you might think that the doctors should see it.
You want a doctor's opinion?
For example, an injury, a cut, something like that. And we've had this in the past where our son had an injury and the way that was glued was not great. I mean, do you know what I mean? Like the way it was glued, this is going to last forever. This is going to be a mark there forever because of the way that it was dealt with at the time. And do you leave a cut with a bleed open? You shouldn't. You know, I just done my first aid course, and they told me when there's a cut and there's a bleed, you have to put something. You have to put a cloth. You have to put anything. You don't worry about germs. You have to stop the bleeding, and you have to put something and put a pressure to the cut. And back, like if I say 10 years ago, if you go to a chemist, the pharmacist would offer you a help and would deal with these, emergencies.
You get more help in the chemist than you do in the hospital sometimes.
Yeah, but these
the
days,
GP, if you can get
these
an
days,
appointment.
because of so many other things like COVID and all of that, people would back up and say, like, no, you go and see a doctor, but between that time until you get seen by a doctor and you have all these blood or, do you know what I mean? Like, shouldn't you just offer the help? Shouldn't you just be that person? I'll help you. The nurse, you say to her, for example, one person is not enough. This is a cut, you need a lot of people to support you. And they'd be like, no. And then once they are offering the service, they can see the struggle and then call for help.
And it's like, I told you this would happen.
Why
Sometimes
not listen
if you listen to the patient,
the patient
will tell you what works for them or how their child will respond.
Yeah. And being in the waiting room for many, many hours, really, really, so many people walk out unwell. They go with an emergency, they walk home unwell, and they stay for a good 2-3 days unwell because of the waiting hours. No food, no toilet, tired, seriously, like, God knows what you got as well from the people sitting next to you.
Don't eat the banana if it falls on the floor.
That was a patient's advice.
We've visited a friend recently in hospital who is in a bad way, but seems to be doing well. I think he's doing well because a lot of people are coming to visit him. I'm sure maybe he's getting good treatment as well. I don't know.
In Islam, it's sunnah to visit. It's sunnah, it's recommended, it's loved by a Muslim to go and visit a sick person.
Yeah.
You get rewards for it.
Yeah.
And that's because of how much joy you bring into this person and not leave them abandoned,
Yeah.
you know?
I mean, he brings me joy as well. Like, he's a very
He's
a very good guy.
But I think we should really encourage visiting one another.
Yeah.
You know, some people, when they are unwell, they don't want to see anybody. Like, there is this culture here where if I'm not well, leave me to be, you know?
Until I recover, yeah.
Or you might get it, or you might be
catch
infected.
Well, you can't catch a broken back.
How
luckily.
can you criticize a service in a polite manner?
You say, I'm not being rude, but...
Every time someone says this, but
I'm not being
this
racist.
is already
but,
being rude.
look, if you want to cushion the blow, get the good things out of the way. Say, I like the fact that the wallpaper was nice, or it was clean, it was a clean environment, and I was spoken to politely, if you were. But you know, 2 stars and a wish, as they say in school.
Okay.
Good,
well,
and
we had
even better if.
Yeah, we had what to improve.
You know.
Yeah, even better if what went well, and www what went well, and even better.
I'm a
if.
very positive person. I don't like to give negative criticism.
So, like, sometimes I honestly used to look at someone's work, and it's excellent. There is nothing
better.
even better if.
Yeah.
At their level of education,
Yeah.
they were excellent, in my opinion. I felt unfair to write even better if.
Okay. Would you write perfect?
I mean, I teach a young student, and I say to her, excellent.
Yeah.
I don't say to her, you know what, even better if you...
I think if you look at young kids, they need the praise more than the
Yeah.
You know.
I'm not always with the even better if with young age, for sure. Like you always say, model it. That's the way of teaching it.
What's that?
Model, not you, as in, like, you know, when you read and you study and model the good behavior or the good teaching, and you would hope that your students, your kids,
when you go to hospital, act like a good doctor and see what they do.
Model it. You have to be polite when you speak to other professionals. You have to be polite, because you're not going to get anywhere if you are rude. And now you see all these signs of we're not going to accept offensive.
Oh, it's always there. Warning: we don't
clients.
accept any rudeness.
Offensive.
It's like they've had a lot of complaints already. I'll never forget going to just on how to deal with rudeness.
Mm-hmm.
I went to the dentist I think it was the dentist or a doctor, with Tom, my good friend from the school days. And he went up to the desk. He arrived for his appointment, and he said, "Oh, good afternoon. I've got an appointment at 4 p.m. And the rude woman behind the desk sarcastically goes, "That's amazing. What's your name?" Without even thinking about it, Tom, instead of responding to the rudeness to the woman, turned to me and said, "That was rather rude, don't you think?" And he's the kind of guy that's very good at dealing with a rude person or a scenario. He turned to me.
What if he didn't have you there?
He would have spoken to a stranger and just said, "That was rather rude, don't you think?"
Okay.
Not addressing the person.
Okay.
And that's a good tactic. Speak to someone else. And I would occasionally do that in school if I don't know if it's the right way to do it. If someone was rude to me or being very silly, instead of addressing the behaviour head on, where you'll get a confrontation, I'll look at someone else and just say, "Can you imagine being like that?" or something like that, and it just undermines it, and they can't. There's no conflict. So
you're avoiding
you
confrontation.
can deflect it, yeah, but that person really feels it because they feel like they're being humiliated back in front of someone else, and they can't then have a go at you because you're not even talking to them.
Yeah.
So there you go. Thank you, Tom, for that technique of how to be rude back without too much trouble.
Okay, I'll
Did that
try
answer your
and be sort of like go around the answer, but I get it.
Yeah.
I'm smart enough
Deflect it.
to get.
That was quite smart, don't you think?
Don't you think?
Don't you think?